And one thing is actually you need to know basically how hemostasis occurs. If you have a cut injury, let's say small damage to your vessels, what happens is first thing is your vessel will be contracted, right? Reflexly, first thing. But that is not a part of the clotting mechanism. But the clotting, rather hemostasis mechanism. And then what happens? The second step is actually the small damages in the blood vessels can be plugged with your small platelets. That's called platelet plugging. Okay. And the third one is the actually around the platelet plugging, the clotting factors comes and attach to it, and the the coagulation cascade will be started. Understand? Now the coagulation pathway is also described in different ways. One is the olden way of classification on describing it, not the classification, alternative pathway and the classical pathway, something like that. And you have a pathway of describing how coagulation occurs. That's the third one. New one of all, there's a thing called cell-based module. All will be asked in the exam. Okay. The importance of this hemostasis is actually there are problems with there are diseases like hemophilia, 1NB, Glanzmann's disease, and the von Willebrand's disease. And what are the factors deficient? Those are some of the things. And the other thing is how to tackle some of the clotting factors. For instance, in MI, you will have to reduce the clotting. Okay, you will be use heparin and various things. Okay, anti-clotting, antiplatelet drugs like aspirin, clopid. So I think yesterday you discussed with Dr. Vijayananda, Ashok Vijayananda did that, I suppose. Today we are going into the physiology, what happens in the base. Okay, right. Right. Now the blood, sorry, right, and hemostasis. Now three major systems in, as I said, vessel wall is important. If you take a vessel wall, if the hemostasis, well, wall is involved, and the platelets are important. Coagulation is important, right? Vessel wall, two main factors. One is the endothelium. Endothelium inside layer is very smooth. So as a result, the smoothness prevents the clotting basically itself. And it doesn't try to catch something. Okay, and the inside the endothelium you have an extracellular membrane, that is a basement membrane underlying the the under surface of the endothelium. Now, if it is exposed, it has collagen type 4 exposed, it tend to clot. So that is the problem. If your endothelium is damaged, there's a risk of clotting. And the platelets is another thing. Sometimes you may have low platelets bleeds. If you have a high platelets, try to clot. On the other hand, coagulation cascade, they are your proteins. They are actually proteins. They are proteins, right? And now coagulation cascade won't occur properly in hypothermic situation. If your patient during surgery is hypothermic, there is a problem. Okay, so you have to correct the temperature 37. Okay, right. Right. And then, now we are talking about the endothelium now. Endothelium has antithrombotic functions. What are the antithrombotic? One is it covers the highly thrombogenic basement membrane. I told you, basement membrane is completely covered with endothelial layer. That is one factor which is preventing clot formation. Uninjured endothelium, smooth and the other thing is secrete PgI2, that's a prostacyclin, and not nitrous. Understand? It is nitric oxide, which is a dilator, right? Endothelium inhibits platelet binding. And the other thing, ADPase counter the platelet aggregation. It has ADPase, so that contra to the platelet aggregation. Okay, so those are some of the factors, and apart from that there are other factors. Endothelia, like the heparin like molecule, they have, endothelium has heparin like molecules. Okay, active activate those heparin like molecules activate antithrombin 3. Activate antithrombin 3. Other thing, a thrombomodulin changes the specificity of thrombin, activates protein C, which inactivates factor 5 and 8. Understand? Now, thrombomodulin is modulate something, uh, modulates thrombin and activates protein C. There's a thing called protein C on the way, which actually inhibit clotting by inactivating factor 5 and 8. So that also thrombomodulin is produced by the endothelium, and endothelial cell produces TPA, tissue thromboplastin activator, which activates fibrinolysis via plasminogen to plasmin. Okay, so it try to eat the clot basically, right? Automatically. And now the what are the functions of the prothrombotic properties of the endothelium? Endothelium can clot even. There are actually endothelium has a balance. One thing is it prevent clotting. On the other hand, it promotes clotting as well. So it has a balance always. Now it can synthesize the 1 millibrand factor, which is at the endothelium, which binds the platelets. Platelets actually bound to 1 millibrand factor. Understand? So if you have a problem with the millibrand factor is deficient 1 millibrand factor, platelets will not be functioning. And at the same time, factor 8 as well. And the release of tissue factor is another thing. Release of tissue factor is promoting clotting, and the production of plasminogen activating inhibitor is another thing. Other thing, membrane phospholipids bind and facilitate activation of clotting cascade. Okay, so those are the things which are endothelium can clot in these things. Okay, now as I said, after your injury, vasoconstriction is the first one. How? This endothelin will be released by the vasoconstriction. This is a vasoconstriction. Now, so endothelium cells produce which is called endothelin. That is the enzyme and the hormone which causes replace vasoconstriction, and the site will be try to close it. Okay, that's so the vasoconstriction. Now the primary hemostasis happens with the platelet. This is called platelet plug formation. Once the endothelium is damaged like this, now this is the basement membrane is exposed. Now it is anti thrombotic actually. What happens? The first one, platelet addition, and the shape is change of the platelets, and then the granules of the platelets produce ADP and thromboxane, which attract more and more plates to the site, right, like this, and it is a plug formation. That's a called aggregate වුණාට පස්සේ තමයි be called plug. Now this collagen type 4 is the most important factor here in the basement membrane to start with this, right? Additions and various things. Okay, this is called platelet plug formation. This is the second stage of this hemostasis. The third, right? Now what happens? The 1 millibrand factor, as I said you, platelets have a lot of receptors. One is the glycoprotein 1b, which attach the 1 millibrand factor. On the other hand, it has the what is this GP2B, the glycoprotein 2B and 3A. So those will attract fibrinogen and inter bonds between platelets, and platelets might occur with through these things. Okay, understand? So this is done with the glycoprotein 1B. This is done with the this bond will be done with the glycoprotein 2B and 3A, right? And then these are the binding, the way of binding. Okay, deficiency of this one, glycoprotein 1B, can bleed and called Bernard-Soulier syndrome. Deficiency of this 1 millibrand factor called 1 millibrand's disease. Okay, very simple. Okay, and this one 2B and 3A deficiency, Glanzmann's thrombocythemia. Simple. Okay, right. Second hemostasis happens once the clot is formed with the, sorry, not the clot, platelet plug is formed. Now here, of course, the tissue factor, once the endothelium is damaged, tissues here produce tissue factor and comes and phospholipid complex expression and thrombin activation, and your cascade start with the clotting. That's called secondary hemostasis with the clot formation. ඉස්සල්ලා අපි කිව්වේ platelet plug formation. Now this is a clot formation. Okay, we will go back again to that coagulation cascade. With that process, we go to this is the actual coagulation cascade, right? Coagulation cascade, these are some other times MCQs. These are serine proteins enzymes. That's a famous MCQ, I think. Right? These are serine proteins. Yes. It's a enzymatic cascade and produced by the liver most of the times, and vitamin K dependent ඒවා තියෙනවා. Three protein cofactors and requires calcium localized to site of injury. Okay, sometimes reversible. Oh, those are the uh, related to this. Now here, of course, you have your cascade. You have two paths: intrinsic pathway, extrinsic pathway. Extrinsic pathway start the tissue factor, which was described earlier. Now, if the tissue is damaged, tissue factor pathway start with the tissue factor formation. It will in turn activate the factor 7 and factor then 10. This is extrinsic pathway, and common pathway comes to the common pathway, factor 10 and factor 5. These are calcium as well here, and the thrombin is formed. Thrombin itself cause fibrinogen to fibrin conversion. Now, fibrin is actually a network, mesh එකක් වගේ. So, forms a clot. And this will be further augmented with the factor, I think this is called Hageman factor, as I remember, the factor 13. The hard clot will be produced with that. Okay, out of this actually, factor 10 is important, right, to us. And thrombin, that's factor 2, is also important. The fibrinogen is also important. Fibrinogen is the largest molecule. It's a mesh-like thing. All right, molecular weight is about 900 something. Okay, fibrinogen is the largest molecule of this cascade is fibrinogen. Okay, which is inactive. Fibrin is active. This is the factor 2. Now, importance of thrombin, that's a factor 2, is, right, it has a lot of other interactions as well. For instance, even though we describe the classical pathway like this, it has other things like it can activate the factor 5, that's one thing, to augment further clotting in this direction. On the other hand, it can activate the factor 8 here and further augmentation this way also. So it can augment a common pathway, and it can augment the intrinsic pathway as well, factor 2, right? So factor intrinsic pathway start with the factor 12, and this is factor 11, this is factor 9 and 8. So it comes to the common pathway. Now there are problems with this pathway as well. One is actually factor 8 deficiency is hemophilia A. This one is hemophilia A. Factor 9 is hemophilia B. That's called Christmas disease. We call it Christmas disease. That's called hemophilia B, right? So that is important, right? So these are the things. The important pathway is that the extrinsic pathway, intrinsic pathway, and fibrinogen is the largest molecule, and which mesh-like thing ඔක්කොම එකතු කරගෙන clot එකක් හදනවා. Thrombin has other intermediate reactions as well, right? Okay. So actually these were initially not described. Actually these came with the finding of the cell-based module. Okay, initial classical pathway එකේ මෙන්න මේවා ටික නෑ ඇත්තටම, right? Okay, these interactions. Okay, right. Yeah, sorry, this okay, same thing, right? Right. Okay. There's another interaction actually. If you this is the common pathway, right? This is the common pathway, 10 and thrombin factor 2, and this is a tissue factor pathway. If you can remember, that's 7. Factor 7 is important again, it can augment the intrinsic pathway on this direction. That can increase the fat Christmas disease actually, and so on. Okay, that means Christmas, not the, I mean, factor 9, and augment this pathway as well. Understand? That's why now some of the disease, of course, factor 7 is expensive now actually, and can be used in hemophilia as well. Now hemophilia, uh, because factor 9 and 10 is absent, then this pathway can be activated with this pathway and again augment this pathway as well. So there's a place for that as well. Now factor 7 is actually used nowadays for bleeding at a, I mean, higher bleedings. We ultimately we may use factor 7 as well. But so to augment all these cascades. Okay, right. And there's another tissue factor pathway inhibitor. That's a factor 7 and 10. Sorry, factor 10 and 7 will be inhibited actually on this one, right? You don't worry about too much, right? Right. So that's another. Now this is the, so basically what you are expected is to, now if you get this pathway, you need to know you should be able to this මේ ටික අඳින්න පුළුවන් වෙන්න ඕන ඔක්කොම ටික, right? Interactions නැතුව. Okay, that's the important thing. And the other thing is this pathway is measured by the INR, and this pathway is measured by the APTT. Now, INR will be in relation to the extrinsic pathway and the common pathway. APTT measurement is in relation to the intrinsic pathway and the common pathway, both. Understand? Both. Okay. So these are the pathways. Okay. Right. So classical pathway unit. Now now the problem actually, as I said earlier, now in the initial classical pathway there were no other interactions which I described you additionally. But the new model that is called cell-based module, the importance of this is actually is describe the other interactions as well. Get a picture of that. I didn't give this picture because it's available. Difficult to understand sometimes because it's a lots and lots of interactions between the various clotting factors. One is there are three important things in that model: initiation, second one the amplification, and the propagation. Initiation can start, amplify can higher, the multiply, and the propagation. Propagation can, once the clot is at a particular thing formed, it will be extended through the vessel. That's the propagation, right? Initiation start with the tissue factor pathway. Now, if you go back to this one, tissue factor path, this is the initiation they're talking about. Tissue damage start with this, and then activating factor 7 and 11. Factor 2, sorry, factor 2. So what happens is this one, factor 7 will be activated and factor 2 will be activated. So that's the first time initiation, right? Initiation, right? And the amplification by factor mostly on this factor. Understand, this is the one who try to augment and amplify thrombin 2, right? And what does it do? And it activates platelets and so many factors, and try to augment this process further and further, right? Right. And then propagation on platelets, this process on platelets which was formed will be carried forward in the same manner. Okay, so that's a cell-based module. Now there are pictures, just go and see these pictures. Okay, right. Now, physiological inhibitors of coagulation. Now, normally coagulation in our body happens but automatically resolved itself. Okay, automatically resolved itself. Why? One is antithrombin 3. Antithrombin 3 actually acts on factor, um, so many factors, factor 2, factor 7, and I think factor 10 as well. Now, the importance of antithrombin 3 is there are no factor 1 and 2. Understand, even though they called antithrombin 3, there is no antithrombin 1 and 2. Right? So, antithrombin 3 uh, important to us because your heparins, that is heparin and enoxaparin, both are heparins, I think, as I remember, act through the antithrombin 3, which is augmenting the heparins activate antithrombin 3 and inhibit the clotting. Okay, and the activated protein C and S. Now, activating protein C and S means, or now protein C and S also vitamin K dependent, but apart from in contrast to the clotting factors, it will inhibit the clotting. Understand? Protein C and protein S are working on to inhibit the clotting. Okay. The basically inactivate factor 5 and 8. Okay. Factor 5 and 8 mainly. The other thing of thrombomodulin, we said earlier, thrombomodulin binds to thrombin. That's the factor 2, decreases ability to produce fibrin and increases the ability to activate protein C. Thrombomodulin. Thrombus is modulated. Okay, right. Role of vitamin K. Now, if I go to this one, this will be an exam question again, right? I mean, you will be asked to in the Viva also to describe this. What happens here? This I taken from the, I think I took from this book, what is this? Uh, Peckil Williams, I think. No, no, not the Peckil, this other pharmacology book, small book, right? It's a Peckil Williams. Yeah, maybe. That's the one. The procymogen are inactive factor 2, 7, 9, 10. Factor 2, 7, 9, 10 are dependent on vitamin K. So procymogen is these four factors. It becomes activated, becoming carboxylated, right? So all factors 2, 7, 9, 10 will be activated by use of vitamin K. These are active vitamin K, and in turn, what happens is the vitamin K becomes epoxide. That's a inactive form. So vitamin K become inactive while the factor 2, 7, 9, 10 is being activated. Okay. So what the problem is actually, you need to convert the inactive epoxide vitamin K into active vitamin K. Otherwise, this cannot happen again and again. Clotting will be disturbed. Okay. So what I going to do? There are two enzymes. There are enzyme vitamin K epoxide reductases. There are two isoenzymes. So these two will be inhibited by the warfarin. Okay. So the warfarin action is here actually here. So as a result, active vitamin K will not be produced, and these active clotting factors will not be produced, and then the bleeding. Okay, action of warfarin. This will be asked. Okay, uh, I think this I told you, right. What happens is the role of the vitamin K is actually some clotting factors require post translational modification before they are active into the clotting, right? 2, 7, 19 as I did, and protein C and S all are vitamin K dependent. Understand? All these factors 2, 7, 9, 10 and protein C and S are vitamin D dependent. Now understand, these will clot, these will anti-clot, C and S, even though all are dependent on vitamin K, right? Okay, right. Uh, I told everything now, this one. And I think you have done those kind of things. These things, yeah, I think uh, are related to, yeah. Non-physiological inhibitors, coagulate, vitamin K antagonist, and those kind of things. Um Anticoagulants, non-physiological, vitamin K antagonist, calcium chelators, EDTA, citrate, and oxalate. Now, EDTA is in bottle. Citrate also will be in bottle, right? heparin when you take blood, okay, and heparin is another one. I think you have done the this one, right? Now this is the clot, normal clot. Okay, it has platelets, it has fibrin, it has trapped neutrophils, RBCs, everything. This is the usual shape, usual consistence of this the clot. Now, after this clot is formed with time, this will be the complete erased from this place and recanalization will happen usually. How does it happen? Okay, normally endothelial cells releases TPA, fibrinolysis, fibrinolysis, and the thrombomodulin, right? And blocks the coagulation cascade further. So the further clotting will not be occurred with this one. How does it work? And let's say like this. The fibrinolysis happens is actually on top of this clot, you have plasmin receptors on top of somewhere here. So you have plasminogen which will be activated to plasmin and sit on this clot and start eating the clot. That is the fibrinolysis. This is fibrino and the lysis happens with the plasmin receptors. This is the beta fibrin, plasmin, and fibrin split to fibrin. That's called fibrin degradation products. Okay, so the clot will be disappeared. What happens then? Plasminogen is converted the tissue plasminogen activator into plasmin. Now, tissue plasminogen activator is here, right? You have plasminogen here. This tissue plasminogen by the endothelial cells activate this plasminogen into plasmin, which sits on the clot and eat it. Okay, very simple, right? Simple, right? Okay. Now, there are inhibitors of fibrinolysis as well. We are talking about the fibrinolysis. Once the clot is formed, you need to eat it. That is a fibrinolysis. There are inhibitors. One is the plasminogen activate inhibitors and alpha-2 antiplasmins. Okay, there are things like that. Okay, so this is a good picture to show you uh, what happens. This is the clot. It's a complex process, unfortunately, right? This is the clot, and what happens is this is the plasminogen, which will be uh, this red one is a plasminogen converted into plasmin. This is the plasmin and start eating this clot. This conversion happens with the plasminogen TPA by the endothelial cells. Okay, that's one thing. And these are fibrin particles after the destruction of this clot. That's why fibrin degradation products. One is the actually the D-dimers කියන්නේ තේකින් කොටසක් මේ එක කොටසක් D-dimers අපි අඳුරගන්න එහෙමනේ, right? Right. If you have big clots, D-dimer concentration is going up, right? Invariably, it says you have big clot like DVT, right? Not specifically, but you can say. So that's one. And then I said alpha-2 antiplasmin කියලා එකක් කිව්වනේ. So what happens is that this portion, this alpha-2 antiplasmin clots the blocks the plasmin. So that's how it has anti-action here. It won't allow to eat the clot. Okay, so that is an important thing. තොප්පි ටික දාගත්තාම ඉවරයි ඔක්කොම ටික, right? So that is exactly what is happened here, right? Okay. Simple diagram. If you can understand this from the some kind of because Elsevier publication 2005. I think New England Journal of Medicine probably this picture, right? So this is the thing that is happening actually. So basically, I think this is the end of the thing story. You need to know in this section the they will ask definitely about the clotting. If you clotting, then how the hemostasis works, vasoconstriction, platelet plug formation, we should be very clear, and the clotting. Okay. Now, vasoconstriction due to the reactive vasoconstriction due to endothelin secretion, okay, endothelin, and the other thing is the platelet, small platelets is plugged here. Let's say, let's go back. Yeah, somewhere here. Right. So this is the first thing, vasoconstriction. Okay, by the mainly endothelin release, endothelin by the endothelium. Easy to remember actually, right? Okay, and then you go to the nicely platelet plug formation because this damage collagen type 4 mainly gives a rough surface, and this platelets is formed, shape is changed, and the granules also release these things, and the further aggregation, this is called platelet plug. Small plugs will be formed with the platelets. Okay, right. And then of course you go to there are things that you can, when it happens to the platelets receptors and diseases, uh, Bernard-Soley syndrome, Glanzmann's disease, and the von Willebrand's factors as well. Okay, so the involved receptors are, I think you know this, probably you have discussed with the clopid, where does it act, aspirin, where does it act, right? I think clopid works on here, of course, blocking these things. Okay, so that's what has happened. And then, of course, on top of this platelet plug, this happens. This happens. This clotting cascade happens. Okay, clotting cascade has, okay, clotting. This is the one thing that's happened. Okay, this is the clot on top of this one. Okay, and normally what happens? This will be lysed by the plasmin, which is coming from the plasminogen, which is converted by the tissue plasminogen activator. Okay, so that's the thing, right? And basically you need to know classical pathway should be able to draw and describe, right? And the cell-based module should be able to describe. Okay, so those are the important things that you need to, and apart from that, some of the things like diseases like von Willebrand's fact disease, what happens, and then hemophilia 1A, hemophilia A and B1, what happens, that is factor 8 and 9 diseases. It's not uncommon actually, right? So those are the things that usually need to know. And the other thing is the action of warfarin should be able to tell in this way. Okay, so those are common questions in Viva as well. Okay, so those are the things that you need to concentrate. But anyway, I would recommend again and again, you need to read your textbooks, because the examiners won't see these pictures or the slides. Okay, when they make questions, but this is a good, I hope this is a good guidance to you to go forward and try to uh, look at the your books and try to understand. Okay, I think we have to finish now. 20 minutes now, 10 minutes more. You can relax and get on with the other things at 10:30. Okay. Uh, okay, then we'll stop here, right? Okay, thank you.